Okay, today's demo is going to be on how to use the Automatrix system, how to use the Automatrix band, and how to remove it. Okay, first we're going to go through the parts and different things that you would need. You're always going to start with, of course, your mouth mirror and explorer, because you will need the explorer to be able to remove the auto band, okay, the Automatrix band. You also need, again, a variety of different wedges, okay. Of course, you need your Automatrix band, okay. The ones we have here, the ones that we're using are medium, let's see, they are medium thin, so these are going to be for, actually, let me see, I think these are medium regular. Medium regular, so the medium regular are going to be for bicuspid and molars, okay. They come in 4 different sizes, okay, and let's see. And of course you can see it is a little band. It is a little band, and it has a little clasp right at the top, and there's a little hole that you'll use the Explorer for afterwards, and you can see it better when we do it on the Typodont. Okay, let's see. The little band comes with, again, it's a thin band. There's a little hole, a lock release hole in it that I'll show you when we're demoing. It also comes with a auto lock loop. Okay, and then of course the coil that we use, our tightening device, okay, our Automatrix tightening device to help tighten it, okay. And then, let's see, we also have cotton pliers, of course, because we need the cotton pliers for the wedges and to get the bands. Now, this part here is very important because to remove the band, you're going to need the Automatrix snippers, okay? Of course, and these are the snippers. And one thing that's important to know about this is that this little shield, I don't know if you can see the little shield here, okay? You can see that it's almost like a little trash can, kind of, okay? It should never be loose like this, and I purposely left it this way so you could see that when you go to snip it, you want this together with that, okay? So you always want to make sure that this is tight. It's tightened the proper way. Because if not, when you go to snip it, then what happens is that the piece falls into the patient's mouth. There you go. So now I can open and close it and it stays there. Because basically, again, this is like the little trash can and it gathers it in here. And what you always want to do, in addition to making sure that it's tightened at the very end, you always want to empty out the tips that you were able to snip off and catch. Because a lot of times you'll see that people will leave it in there and then they'll sterilize it and you'll go to use it for someone else and voila, you go to snip it and they don't realize and the other piece falls out into someone else's mouth. Regardless whether it's gone through sterilization or not, you know, it's a sharp and you want to dispose of those in your sharps biohazard box, okay? Alrighty. The next part is we are going to work on, let's see if I can zoom in here. And I think I may need to move what I have in the background so that it doesn't focus on it. See, that made a difference. Maybe not, but we will make it work. Let's see. Bear with me here. To zoom out just a bit and move my anything that might be causing it to focus on something else. There we go, looks like we almost got it. There you go. Okay. Pull back just a little. Okay, and of course you can see here we have our prep tooth, which we're not going to use today, but we are going to use our tooth that we have, and let's do it like this a little bit so you can see it a little better. And move this out just a bit. There you go, perfect for time being. Okay, it's about as close as I'm going to get, guys. So, okay, and here we have number 29. It's our first mandibular molar, and we are going to set up, we're going to use the Automatrix for the MOD. So it's missing the mesial and it's missing the distal back here. Okay, so we already know that we are using a medium regular. We already have it in our pack. Okay, and from our instructions on how to use the Automatrix, it talks about how we can get our matrix band. Okay, and here we go. Here's a close-up of it. See, here's our little part that we will clip after. Okay, here's the little part that's coiled, and right in here is the little hole. Okay, and I'll use the Explorer just to kind of go through it so you can see the hole where it is. Let's see. Pull this back just a little. There you go. You can see that there's a little hole in there, and this is what you will use to lift it up after. Okay, so the coil, the part we're going to snip, the little hole. Okay, one thing that in seeing the video with the Tafelmeier that you're going to notice is that there's the gingiva end and the occlusal end. Okay, and it's always, let me see if I can do it here, if you can see it, but there you go. See how the wider part will always go towards the top because it's wider at the top and narrow at the bottom. So the narrow part will be the gingiva. The wider part will go towards the occlusal. Okay? Alright. So it does tell us that we can just place it on over the crown, and the directions does say to go ahead and use our finger to hold it in place gently. Okay, once you have it in there, to hold it in place, and it does say that we can either put it towards the buccal or towards the lingual. Preference of the doctor. Okay, we will use our Automatrix tightening device, and it goes in the center of this little coil that I showed you before. If you need to burnish the matrix, you can, but usually on these you don't need to. Okay, and all I'm doing is holding it. Let me see if I move it back just a little, you can see what I'm going to do. Oop, hello, back. Okay, it says to hold it with your finger to stabilize it, and to go clockwise to tighten. Okay, to go clockwise, I'm going to move my finger just a little so that you can see. To go clockwise to tighten. Let me see if I can zoom in a little bit more now. Okay, hold on 1 second, sorry. Technical difficulties, I need an assistant here. So you can see a little bit more. There you go. So we're back in focus here. Okay, so we're going to stabilize it with our finger and then go clockwise and tighten till we hear that click. Okay, once we hear that click, we know it's nice and tight. To release this device from the coil, we go counterclockwise and we lift up, and voila, it comes out. Okay? Now, see if I can give you a different view here. Let me lift it up a little so you can kind of see how it looks there. Okay? Right believe 1 to 1.5 millimeters. Okay, and let's give you the lingual part, lingual view. Okay, you can see right here, it should be 2 millimeters or so right above the cusp. Okay, so you can see that little edge. All right, now, okay, we're going to choose, let's see, we're going to go ahead and choose, we'll need 2 wedges, so I'm going to go ahead and choose a blue wedge. And we'll come in towards from the lingual. Let me turn it around. Sorry, I'm kind of doing this around the camera. Okay, so of course you want to try to work the best you can through the mouth, not through the cheeks. Remember that this is what I was trying to draw before, and I guess I'm wearing blue gloves and this doesn't really help any, but this is that point that I was talking about. Let me see if I get a different wedge just for the demo here. Maybe an orange one. Okay, but it almost looks like a little boat. Okay, this is the pointed part, see right there, and then the flat part, the flat wide part goes towards the gingiva, sharp pointed part goes in between. Let's see, use your cotton pliers, okay, to push it in. Okay. And let's see. I'm going to go ahead and try this one. We may need a different size, but we'll try it. Okay. And probably this one was probably too small because I had gotten it for demoing, but let's go back to a blue. You can use your cotton pliers to help push it in there till it's nice and snug. Okay. And there are different sizes, so you know it will come out on this side a little bit. So I probably would have gotten a shorter one so it doesn't poke the patient. Okay. Okay, so this is prepped and ready, and then they could do their filling. The next thing that we would do is, before we remove it, what we're going to remove first is, of course, is always going to be what? It's going to be the wedges. So we'll have to remove the wedges. Come in here, remove the wedges. Okay, 1, 2. Okay. Now let me see if I'm showing you, if I'm able to show you how it's going to look like that. There you go. Let me try it like that. Okay. So you can see that this is the part here that we're going to be snipping, the part that's above the top. Okay. Again. Okay, we're going to snip this. Then we're going to use our Explorer to lift up, okay, snip it, and then lift up with the Explorer and remove it. Alright, so we already checked our tightening devices. We know that this is nice and tight. Our little trash can. Okay, so we go in. Let me see if I can do it to the side so you can get a good view of me snipping it there. I don't know if it's going to show or not, but we'll try. Maybe like this. Oh no. Maybe if let's see if I do that. Actually, I think it's better. Sorry. Just want to give you the best view you can to see it. Okay, well that'll do. Okay, you come in to the front, make sure you have it in there completely. Let's see if I can move you over to the side so you can see how it is. Okay, maybe like that. Then you snip it. Okay, just then you would come with your Explorer. Okay, and you would grab that little, let me look through here so I don't look through. Okay, you would grab it. You could also have the cotton pliers if you need to. Okay, ready for the doctor. You would grab it and gently release. Now, notice that a part fell in there. Okay, this part right here, this is the auto lock loop. Okay, the part that we snipped out. So you automatically want to have cotton pliers or the suction to grab that right away, because you don't want the patient to swallow it. Okay, because it does fall in there sometimes. Okay, but this was in here anyway. You would lift this up. The doctor would be doing this, you would be suctioning. So, okay, it comes out. Oops, and there it goes. Normally it doesn't flip out like that, but this time it did. So expect Murphy. Remember, when you least expect it, expect something to happen. So you would be coming out with this. Again, this goes into the sharps container. Okay, any part that came off, this lock loop that fell down, the one that fell in once we cut the tip off the top, you can either suction it up. If you can't, if you see that it's going down, just suction it. That's the fastest thing to do. Again, if not, you get cotton pliers, and then you can see in here that there are pieces, and you can see that you would again release this part. Make sure to throw that away, empty it out, empty out the trash. Okay, all that goes into the sharps container. Okay, and there you go. That's how you use the Auto Matrix.